Therapy is shit hot. It's what you want, it's what you need, and let us tell you how to go and get it. Some of my early work was trying to answer the question of why men don't seek help. And more, as I delved into the literature, it became clear that that question was actually the wrong question to be asking. In fact, it was, men are seeking help, but they're not receiving the help that they need. And so what we started to see was actually there's about a 40 to 45% dropout rate where guys are leaving therapy prematurely because it's not reaching them where they're at.
There's more stigma related to psychotherapy. For example, in the US or Canada, psychotherapy is getting more common also among men. This takes up to 10 years until this also shifts in Central Europe, let's say in German-speaking Europe. And so there's the notion that men are more reluctant still to psychotherapy. They're definitely more concerned to keep their problems with them.
Before my academic career, I was a clinician. I worked in mental health clinics, and I saw men, I saw women. I did notice that men were not as receptive to services and that men suffered a lot, and it was often hard for them to get help and to find help that was effective.
So often when I'm out in community, men continuously tell me, I don't know how to work with this mental health system. I don't know what therapy is or how it works. And so all of these expectations and stereotypes that abound throughout the community are really acting as barriers to men getting the support they need.
A lot of guys think, oh, guys don't get depressed. Well, to be honest, that's bullshit. Guys do get depressed. The more conversation we have about mental health, the more we support people's efforts to look after themselves. In fact, it creates an expectation that we ought to look after ourselves. And when we think about mental health support, it really is no different than, say, going to physiotherapy to rehab a knee after an injury. If we think about depression as a psychological injury, you don't try to tackle it on your own. It's really too beastly to do. It's too tough. There's a lot of people out there that have a lot of expertise and experience and wisdom. Why not reach out to them? It honestly is the best thing that you can do.
I think it's difficult to ask for support if you can't also be vulnerable. But I think there's this idea too that if you're vulnerable, you can't also be strong. But I think there's a great deal of strength in being vulnerable. A big part of increasing awareness of men's depression is really by having men tell their stories. Through those stories, they can see that depression might not look quite like they think. That when they see guys talk about, like, I wasn't necessarily sad or blue, but I was touchy, irritable, that can kind of open up their frame of reference also for what depression in men might look like.
Mental health conversations for so long have been in the dark. What we need to do is bring mental health conversations into the light. And we need it to have humour. We need openness and lightness when we're talking about mental health. It doesn't need to be this deep, dark secret. It needs to be an understanding that this is how we live.
I think reaching out and getting help in some way would be of great benefit, rather than waiting until things are more dire and desperate, that they can reach out and say, look, I feel I'm a bit stuck, and I think that should be a great entry point into getting some help and doing some good work. So it's a big question. It's an important question. How can service providers best help men and meet their needs? My take on that is by personalizing their approach, by finding out who he is, what his story is. I think that's a good way of going forward. There shouldn't be a one-size-fits-all approach. Where I'd like to see things go with that is to do some work on what helps men work on these issues. What is it in therapy that is likely to be useful for them moving things forward?
We definitely need to tackle depression in men from both sides, from the biological perspective as well as from the psychological or from the gender perspective. And so it's a real goal of our research that we do studies that really research parallel questions, for example, testosterone levels, how do they change over time in therapy.
When we're talking about how therapy or counselling kind of looks, we adapt. We adapt to the guy's needs. And what's really important is that every guy, looks different. And so as a result, we need to make sure that the services are adaptive, are responsive. Rather than putting more responsibility on the shoulders of men, we need to go, okay, there's a systemic issue here, which is that the whole psychotherapy field hasn't been built with men in mind. And that's where the title came from. And that's when we decided we're going to create practitioner education. We are going to lift up the workforce in the field so that they can connect with guys accordingly. Rather than guys needing to adapt the way they do therapy, that's not how it works. We need to make sure that the health practitioners are engaging with guys in a way where they understand, they respond, and they respect their masculinity.
On one hand, there are plenty of guys who seek out mental health care. They go into an office, they find a counselor. But for many other guys, what that looks like is bringing that mental health care to where they are. I think there are lots of examples of what that could look like. In the US, Veteran Services has vet centers where they put these vet centers in communities and they do lots of things. They resource vets, but they also have mental health clinicians there in the vet centers, right? And so it's bringing that mental health care out into the community.
Just over a year ago at Heads Up Guys, we created a therapist directory. We recognized that there was a gap. People were coming to the site, they were engaging, they were learning a lot about depression, suicidality, and one of the things that we really promote is reaching out for professional help. So that's why we created the therapist directory. And this is the world's first therapist directory dedicated to men. And since we launched that directory, as I said, just over a year ago, we've had more than 10,000 connections between our visitors and therapists on the directory. It's so warming to know that guys are out there taking the steps, making action toward bettering their own health. So we needed to think differently about how to connect and support and serve men. And one of those ways that we thought might offer some potential is meeting guys in the e-space, if you will. A lot of us will go to Dr. Google and type in symptoms when we're feeling ill, trying to sort ourselves out before potentially connecting with other sources of help. So we thought, why not be there? Be there for guys, show them that we're here for them as men, we're here to support them as men. We've had more than 4 million people come to the site, and at present 75,000 people a month visit the site. And what this is showing us is that we're indeed serving a need. What it's also showing us is that there's still tremendous potential to really utilize this space to better serve men.
We've been going for so long at talking about the problem when it comes to male suicide, and that narrative hasn't worked. So we need to come at it from a strength-based narrative. We need to look at guys and go, what keeps you alive? What keeps you here? What can we give you? What can we offer? How can we bolster social connection, community, resources? For too long we do this top-down situation where we work in an ivory tower, we build a resource, we send it into the world, and guys go, what is that? That's not something that I want. You didn't ask me. And so what we're trying to do moving forward is to make sure that everything is built with the guys, so that when you go to them and you say, here is this resource, they go, that's for me. That's what I need. That's what I was looking for. Let's bolster, let's empower, and let's find a way to connect with guys in a way that makes sense for them.